Welcome back to this afternoon session. Last year, I had my genome sequenced, and behind me on the screen, you'll see a very unique piece of DNA, a piece that only codes for me. Now, this sequence does something very special and arguably very important. This code, ladies and gentlemen, means that I've got wet sticky earwax as opposed to dry crumbly earwax, which is actually really amazing whenever you think about it. But what's the point? Well, this weekend was the 10th anniversary of the Human Genome Project, which first mapped out the building blocks of the human body. Back in 2003, when Steve Jobs paid £10 million to get his DNA sequenced, last year it cost me just a couple of £100. And I found out I'm condemned to a life of type 2 diabetes, prostate cancer, and rheumatoid arthritis. So in this session, we're going to look at healthcare ideas like this that are likely to make the biggest impact by 2050. And I'm really excited we've got three fantastic speakers in this session with us. We're going to take lots of questions at the end, and I hope you know the drill by now. Do tweet, do use the mobile website to submit your questions with the hashtag Quality2013. So, without further ado, I'd like to introduce our first speaker. This is Lucien Engelen, and he's Director of Innovation at the Radboud University, and is going to talk about crowdsourcing health. So across to Lucien.
Thanks very much. Could I have my slides on, please? Thank you. Yeah, it works. Thank you. First of all, I hope you had a great lunch. We had to skip hours. We had to put on our mics. So after lunch, it's very difficult to get back on stage again. So I present to you a very small TED video, about 3 minutes, which is basically the tagline of this conference: how to create a movement.
So ladies and gentlemen, at TED we talk a lot about leadership and how to make a movement. So let's watch a movement happen, start to finish, in under 3 minutes and dissect some lessons from it. First, of course you know, a leader needs the guts to stand out and be ridiculed. But what he's doing is so easy to follow. So here's his first follower with a crucial role. He's going to show everyone else how to follow. Now notice that the leader embraces him as an equal. So now it's not about the leader anymore, it's about them, plural. Now there he is calling to his friends. Now if you notice that the first follower is actually an underestimated form of leadership in itself. It takes guts to stand out like that. The first follower is what transforms a lone nut into a leader. And here comes a second follower. Now it's not a lone nut, it's not two nuts, 3 is a crowd, and a crowd is news. So a movement must be public. It's important to show not just the leader, but the followers, because you find that new followers emulate the followers, not the leader. Now here come 2 more people, and immediately after, 3 more people. Now we've got momentum. This is the tipping point. Now we've got a movement. So, notice that as more people join in, it's less risky. So those that were sitting on the fence before now have no reason not to. They won't stand out, they won't be ridiculed, but they will be part of the in crowd if they hurry. So, over the next minute, you'll see all of the those that prefer to stick with the crowd, because eventually they would be ridiculed for not joining in. And that's how you make a movement. But let's recap some lessons from this. So, first, if you are the type, like the shirtless dancing guy, that is standing alone, remember the importance of nurturing your first few followers as equals. So it's clearly about the movement, not you. Okay, but we might have missed the real lesson here. The biggest lesson, if you noticed, did you catch it? Is that leadership is over-glorified. That yes, it was the shirtless guy was first, and he'll get all the credit, but it was really the first follower that transformed the lone nut into a leader. So as we're told that we should all be leaders, that would be really ineffective. If you really care about starting a movement, have the courage to follow and show others how to follow. And when you find a lone nut doing something great, have the guts to be the first one to stand up and join in. And what a perfect place to do that, TED. Thanks.
So let's cherish the lone nuts, to be honest. I would like to start a movement today as well, a movement that we call at Radboud University Medical Center, Create Patients as Partners. One of the places that I'm able to do this is at Radboud University, and we run an innovation shop, the Radboud REshape and Innovation Center, in which we actually try to create new projects, new research as well for patients to work as partners. But I have to ask you a question first. In this audience, who of you attends this conference because he or she is a doctor? Please raise your hands. Okay, great, thank you. Who is here because he or she is a researcher or student? Okay, thank you. Researchers? Policymakers? Who of you attends this conference because he or she is a patient? Who's invited to be here as a patient? I see one, two maybe. I think that's one of the questions that we have to ask on medical conferences. Why do we not incorporate patients in our conference, in the advisory roles, in program committees, on stage, and why do we not still grant scholarships for patients to attend these conferences? That's the reason that last year, we ignited the Patients Included Act. An act for conferences to show that they really take patient incorporation seriously. And already a lot of conferences all over the world are incorporating this vision. And I encourage you as well to do the same. Just for the sake of it, I show you a few patients. I brought some of them with them just to show it as well. What we are creating at Radboud University in the Innovation Center is actually a kind of Swiss Army knife. A Swiss Army knife for tools to create better healthcare, to create better research, and to create better adherence. We do this with a lot of tools. At first, we try to capture ideas of our colleagues. Not only from doctors, not only from nurses or administrators, but also for people from logistics. These little ideas we try to mold into small projects, regularly run in 30 days from idea to realization actually. And also we try to research the stuff that's being done. And our researchers have the assignment not to prove that it works, but to prove that it doesn't work. And you can imagine that somehow gives some problems with our innovators, to be honest. Also, we try to transfer the knowledge that we have raised into our projects. We do this with our REshape Academy, 8 masterclasses a year about social media, about finance for innovation, but also on research. And last but not least, we also run some of our conferences, which 2 of them was TEDx Maastricht and TEDx Nijmegen last week, in which we try to improve with high impact speakers from all over the world to change healthcare. One of the projects that we've done is that I assigned 3 years ago a new role into our team, our CLO, our Chief Listening Officer. And the reason I did that is that we've discovered that a lot of people, based on research, give answers to people that have some constraints and a relationship, for instance, for their healthcare. And what she does, she's not a doctor, she's not a nurse, she talks to every patient that is incorporated in our projects. And there's a lot of low-hanging fruit coming out of that. I've been asked to step on and look into 2050, for instance. What will happen? I would like to share with you one of the things that will be happening that I think that you as researchers and you as doctors and nurses will be subscribing to data from patients, owned by patients, issued by patients. I brought to you a little video of 2 minutes, which is made for the Qualcomm X Prize at present. It's a prize of $10 million for the group that creates a doctor in a smartphone, so to speak.
Technology has given us an unprecedented window into the human body. But on a day-to-day basis, we're still in the dark about our own health. We are changing that.
You okay? Do you feel okay?
What if instead of fearing the worst when you notice something out of the ordinary, you could identify the condition yourself? Getting the right diagnosis would save you worry
It says it's roseola.
and an unnecessary doctor's visit.
Rest at home. It's okay.
Instead of hearing about a viral outbreak on the news, imagine you got an alert that was tailored to your family's needs. It would also give you advice about what to do next. What if you had a way to identify what was wrong right away?
It says it's 103.8.
A way to get all of the information you need to understand the situation. And in serious cases, you would know when and where to seek help.
It recommends taking it to urgent care.
We're building a way for people to check their bodies as often as they check their email. It's all possible, and it's only the beginning.
Over 300 groups all over the world are working to create these kind of tricorder. And over the course of the next 1.5 and 2 years, in 2015, this prize will be issued as well. Also, I would like to show you a bit of crowdsourcing, which we did with, for instance, AEDs in the Netherlands. We've got smartphones, we've got navigation on our smartphones, and everybody knows where the nearest hotel is, or actually even McDonald's. But nobody knew where the nearest AED, automatic external defibrillator, was. So we've asked the public, we set up a website and asked people, just say where you've seen an AED, and we've mapped it. And I'll go a little bit into it later on. And the third thing I would show to you later on is that you as researchers will be hired by patients in 2050. So, just to go back to Silicon Valley for a second. FutureMed, Singularity University, founded by Google, Autodesk and NASA. The thing we see there is people, for instance, from the University of Berkeley that invented an exoskeleton for people with a paraplegic, the possibility to walk 2.5 hours solely by themselves. Or the stuff that's being done with 3D printing at present, where people are able to print their own systems and for orthopedic surgery within 2 or 3 hours for $77. But the real problem will be designer babies, for instance, that we have the possibility to choose whether the color of the hair and the color of the eyes. 3D printing will be very fast. This is actually printed at the size of a human's hair. And for instance, IBM has Watson running at present with the speed of 37,000 pages per minute, feeding all the scientific literature on healthcare to the system to aid in the end choices, decision making. And the thing that's hitting healthcare within the next 10 to 15 years will be all kinds of devices. All kinds of devices that create big data. And the good thing could be that these devices will be consumer-run devices, just like a lot of people own an iPad. And if you use an iPad to set it up in terms of healthcare, you know that the adherence will be a lot bigger. In the Netherlands, in one of the regions, there's a project with 1,500 iPads run for elderly above 60 years. And there was not one question about the technology. The only questions were about the software. This is a little sleeve for my iPhone. A sleeve for my iPhone made by Dr. Dave Albert that gives the ability to run a 1-lead AKG with my regular iPhone. And I'll show you a little video in between about how this works. And I'll switch off the sound for a second. For $200, people can buy this thing, and people with heart diseases and heart failure can monitor their own within 3 or 4 times a day for $9.95 and subscribe to it, and somebody will check it at the end of the line. This is being bought by web shops and is being available for people on a very easy way, so to speak. One of the other things that will be big in 2015, we think, that will be video conferencing. And Maureen talked about it already. We have to come up with systems that do not need extra technology for people to mold it in their homes. And we've set up as University Center in Nijmegen FaceTalk, which is a video conference system, completely secure for healthcare, and does not need any hardware. So patients can connect to their physicians. So patients can connect to their GPs or even to the doctors in the hospitals and even run tumor boards. This is what we call patient included. And over the course of the next months, as Radboud University Medical Center, we bought Epic as an EHR system. We will connect this to our patients, obviously. And patients, for us, patients know best. And the UK-based firm, Patients Know Best, will be connecting for us to Epic at one end, and all the electronic systems, all the e-health connectors will be connected to that. And the patient is in the position to give other people access to their data. So the patient will issue a subscription version to the GP or to the doctor in the hospital. Research, I think, is about asking. And my statement would be that crowdsourcing is about co-creation. And I showed it just earlier on a bit on this AED project, where we made all kinds of apps for iPhone, Android, Layer and stuff. And already 250,000 people downloaded this app. And in the Netherlands, we got a database of over 18,000 AEDs in the system. So crowdsourcing actually works in our perspective. And I showed you the picture already. This is a bit like how it looks like, and it's a worldwide system at present. Just before summer, we will ignite a game on smartphones. A game on smartphones also in crowdsourcing to incorporate as many of AEDs as possible. So once you see an AED, you map it again, and we know that the AED is still present. And if you map a new AED, you get extra points for that. And we hope that people will go out and take a walk and use it as well. On MIT, iWire is a new game used to map the brain at present. And what they do is by crowdsourcing, and already with 80,000 people in the world, and this is a new system that's only up for 3 months, they explore the retina from the brain, and through co-creation, they map it in a very high speed. And the first article will be issued within a month, as I've been told. The world is changing. And the world is changing with this. This is a slide from Kickstarter. Kickstarter is a website when somebody has a great idea, but no money, and the bank is not willing to pay it. You could post this idea and say, I have a great idea. Who would like to help me? And through crowdfunding, people will pay for it. And as you can see, these guys thought that they want to have $35,000 for a pen from which you can write on an iPad. And they raised within 30 days $160,000. These guys were running for an app that controls a digital camera. And they needed, as you can see, $80,000. And 7 days on the row, already they raised about $33,000. And then there comes 2 guys from Palo Alto, wanted to invent a new game console based on open source, sorry. And they asked $950,000 to make it happen, and everybody called these guys nuts, lone nuts. However, 30 days afterwards, $8.6 million were raised. Over 60,000 units were being sold, and it still has to be produced, to be honest. So this is one of the reasons why I think that also this could be a field for healthcare research. And I still think that research being done in healthcare without the patients actually at the table is kind of like driving backwards blindfolded. So that's the reason that we came up with a new system. A new system in which the regular version of creation of research by researchers and business or money or pharma would be flipped around. Flipped around in a way that patients will design their own research. They will create money by crowdsourcing the money, and they will hire in the end the researchers. How we are planning this? We will run online communities for patients, family and informal care. And they can create and submit all kinds of ideas of applied research, actually. From all these ideas, we try to mold a plan, obviously. And with the patient groups and advisory board and voluntarily research writers, we create, in the end, a research plan that will be posted on the website, medcrowdfund.org. At present, still only in Dutch, but just before summer, it also will be available in English. And people can go there and they can boost actually that research. and they can share it on Facebook, and they can share it on LinkedIn, and they can share it within their family, since that's one of the strongest things that we encounter already. People like strong ties. Ties in which I know you and I'm willing to do something for you and to help you with your research. So through social media, this research is being funded. And then comes the time that people say, we've got our plan, we've got the money, let's find a researcher. For that, we've ignited medcrowdpitch.org, a place where researchers pitch themselves in 30-second videos. In 30 seconds, you tell what your specialty is, what your research is, what you have been done, and per article, in 30 seconds, you explain in everyday language what this is all about. And then one and one comes three. The design of the research, the money for the research, and the researcher that has been selected. So just to round it up, from my perspective, you will be subscribing patients' data in 2050. Research versus crowdsourcing will be huge and is a field that creates new boundaries and new perspectives, I think. You will be hired by patients, actually, and patients and family, to be honest. They are the experts in having the disease. And the only permanent in the future in healthcare will be change. I just want to illustrate this with Jack Andraka, which hopefully most of you know, this 15-year-old kid that found a new cancer test for only $3 and rocks the world already. If you would like to chat with me on this, I just recently quit email, by the way, so I'm not able to be emailed, but more on Twitter, Lucien Engelen, and thank you for now.